This segment of the Safe Injection Practices Review addresses documentation. Information sharing through documentation of vaccination is critical. This not only provides evidence of what you have done, but it also helps other providers know what is still left to be completed. Without adequate documentation, patients are likely to miss doses of vaccine, have inadequate spacing of vaccines, or received incorrect vaccines or vaccine doses. It is also important to provide the patient with documentation of their vaccinations so they can begin to build or add to their own personal immunization records. They can share this information with other healthcare providers or employers. Accurate and complete vaccination records have always been important for children, but now it is equally important for adults as new vaccines are making their way into the market and the benefits of adult immunization are more fully appreciated. So, let's talk about our take-home points. These take-home points include prompt documentation of all vaccine administered. Do this in a manner that is retrievable and able to be shared with the patient and other healthcare providers. Document the name of the vaccine, the date administered, the dose, the anatomic location where the vaccine was administered, the vaccine lot number and expiration date, and the VIS date. Include in your documentation the name of the individual administering the vaccine and their credentials. If there is to be follow-up, for example, a second dose in a series or a new vaccine, make sure the patient is aware. Pre-schedule those appointments if possible as a means of ensuring adequate spacing of vaccine doses and follow-up. Add the information into the patient's electronic health record as well as the state immunization system or vaccine registry. Provide the patient with documentation and encourage them to begin to develop and maintain their adult immunization record, just like they do for their children. Document any adverse events reported by the patient so that information is readily available and apparent for other healthcare providers who may also be administering vaccine to that same patient. Submit that information to VAERS, if appropriate. Thanks for your attention during this segment of Safe Injection Practices. I hope that you'll take the time to look at the next segment.